Hello, good morning, everyone. Thank you so much for dialing in this morning on a Monday morning at 9:30 a.m. Welcome to today's webinar, a ToHealth free webinar called Heart Health, the importance of health screening and understanding epigenetics. Now, my name is Nyran. I'm a health and wellness expert with ToHealth, and we are offering this free webinar, this 30-minute session, packed full of useful information, some good hints and tips, as well as some positive strategies that you can take away to think about how can we look after our most important organ in our body, our heart. So the numbers are slowly creeping up, which is fantastic. So I think we'll make a start. As I said, we've got a lot to get through in the next 30 minutes. So the outline for today's session, we are going to define, what is heart health. We're going to talk about the heart itself, the anatomy of the heart. So if you're not quite sure of that, we'll go through that. We're also going to discuss the importance of knowing some really important biomarkers, some numbers, including things like your blood pressure, your heart rate, your cholesterol levels. We'll touch on the topic of cardiovascular disease, more specifically heart disease, because cardiovascular disease refers to the whole circulatory system, whereas heart disease, of course, is specific to just the heart. We'll also, talk about some risk factors, both modifiable and non-modifiable. And I think it's the modifiable risk factors that we'll really hone in on, because that's where we can really make a difference and make an impact through our lifestyle choices. As I mentioned, in the workshop title, we're going to talk about the importance of health screening, regular health screening, particularly after the age of 40. So, what health screening looks like, what you can expect, and as I said, the importance of knowing those all important numbers. And then we'll finalize today's session talking a bit about epigenetics and the link, I suppose, between heart health, but also our overall health, our general health when it comes to epigenetics. So I'd like to start with this slide. Hopefully you can see it. It's a bit of an interactive slide, actually. You can kind of see the blood flow through the heart. Well, the heart is almost like a fist-sized organ. So we all have our own fist, and that's representative of our heart. And it pumps blood throughout the whole body. It's the primary organ of our circulatory system. And as I mentioned a second ago, it's probably our most important organ, right? Because we can't really live without it. Each day, your heart beats up to 100,000 times. So this continuously pumps around 5 liters, but 8 pints of blood around your body through a network of different vessels, arteries, veins, and capillaries. Now, this blood delivers oxygen and really important nutrients to all parts of your body to help your organs, your muscles work effectively and to function. Your blood also carries away any unwanted, waste products and carbon dioxide, of course. Now, your heart has, we often say, a left side and a right side. They're separated by a thin muscular wall called the septum. Both sides of the heart have an upper chamber and the lower chambers. Now, the upper chambers are called the atriums, the left atrium and the right atrium, and the lower chambers known as the ventricles. So the right side of your heart, or the blue side as you look at it, it's on your left as you look at it there, but it's on the right of the body, of course. It receives the deoxygenated blood that's just traveled around your body. It pumps the blood towards your lungs to collect a fresh supply of oxygen. The left side of your heart then receives that red reoxygenated blood, so the fresh blood, to send out around your body again. So it's quite a complex system with a lot of different arteries and veins, and as I said, chambers that are imperative to the circulatory system. So my question to you, something to think about. What is a healthy heart? How do you define it? What does it look like? What does it feel like? Well, a healthy heart means that it beats smoothly, following a normal rhythm, and can also recover quickly after any sort of exertion. Now, the image on the screen that I'll show you demonstrates the normal heartbeat as well as some irregular heartbeats. Now, just taking a look at that little sort of rhythm, you can see the PQRST. The P represents the activation of the atria, the upper chamber, and then the QRS represent the activation of the ventricles, pumping the blood out. And the T is the recovery wave. An arrhythmia is like an abnormality of the heart rhythm, and heart arrhythmias occur when the heartbeat increases or decreases or becomes totally irregular. Heart rhythm issues happen when the heart's electrical impulses fire improperly, causing an abnormal heartbeat. And these abnormalities range from a minor inconvenience or discomfort to a potentially fatal problem. But others may only be noticeable through an examination. You may never know you have an irregular heartbeat. Now, an arrhythmia can feel like your heart is racing. It can feel like palpitations or fluttering. And symptoms of arrhythmia are things like decreased heartbeat or shortness of breath. Could be chest pain, that fluttering or dizziness, even sweating or lightheadedness. I highlighted the importance of knowing some really vital numbers. The first one I want to introduce is the resting heart rate. Now, your resting heart rate represents the number of beats, the number of times your heart beats per minute, so BPM, otherwise known as your pulse. Now, everyone's heart rate is different, and it can change over time. But here on the screen is the range that we should be aiming for. Now, the normal heart rate, resting heart rate, should be somewhere between 60 to 100 beats per minute. Now, we all maybe can do it with the two fingers on the wrist or to the neck. Maybe you have a smartwatch that detects your heart rate, or maybe you wear a heart rate monitor when you exercise. Fast heart rate, tachycardia, is 100 plus, and a slow heart rate, bradycardia, is below 60. Now, if you participate in regular cardiovascular exercise, so running, cycling, swimming, even potentially, weight training, you may have a resting heart rate lower than 60 beats per minute, maybe in the 50s, potentially even in the 40s. And that's okay if you do regular cardiovascular exercise. However, if you don't do cardiovascular exercise and your heart rate is sitting below 60 BPM, then as I said, it could potentially be bradycardia, and that might be worth getting checked out with your GP. The second number here is blood pressure, and we record this with two numbers: the systolic, which is the top number, which is the force the heart exerts on the walls of the arteries during every beat, and the diastolic, which is the pressure or the force in between beats, so when the heart is relaxed. Now, hopefully you can see the image on the screen. Again, the normal, the elevated, the stage 1 hypertension, stage 2, and then hyper sort of tensive crisis. So normal blood pressure should read around about 120 over 80. Now, of course, it'll never be exactly that. We're not robots. So it does fluctuate. Sometimes it might be a little bit higher. Sometimes it could be a little bit lower. It changes. And there are many things that can affect our blood pressure. Physical activity. So if you've just done some form of exercise, or you've been for a walk or gone up a flight of stairs. Caffeine can also affect our blood pressure. Smoking. Stress levels can also affect our blood pressure. But also high levels of cholesterol in the blood. And that's the next number that I'd like to talk about. Cholesterol is like a waxy substance. It's found in the blood. It's a chemical building block. Healthy amount is okay, but too much can increase the risk of heart disease. There are three types of cholesterol in the blood. There's what's known as HDL, the high density lipoprotein, the LDL, the low density lipoprotein, and the triglycerides. And these three numbers make up our total cholesterol. So let's take a look at that in a bit more detail. The HDL is known as the good cholesterol, the high density lipoprotein. And we get that usually from food such as oils, the omega-3s from oily fish. You might like to take an omega-3 supplement. Avocados, whole grains, nuts, seeds, all packed full of good cholesterol. The LDL is often known as the bad stuff. It's often found in animal fats, so the saturated fat, usually in red meats in particular, dairy products, so full fat cheese, the milk, the creams, highly processed food, so takeaways, ready meals, convenient food, and then sweets, pastries, desserts. Now, there is some evidence to suggest that we do need LDL in our blood. So it's not about eliminating it completely, but it's about keeping it at a healthy range, keeping it low. In fact, we actually produce LDL naturally in the body through our liver. So yeah, it's impossible, almost impossible to get that completely down. The triglycerides, also a really important type of blood cholesterol, blood fat. It's a really important source of energy. Hence the word glyceride, glycogen, which is energy. And it's essential for good health. But once again, if you have too much of this in your blood, it can raise the risk of heart disease, cardiovascular disease. So what does that mean? Take a look at this image on the screen here. Hopefully you can see there on the left-hand side, that is an example of a healthy looking artery. Remember, an artery is like a blood vessel, like a tube. Blood flows through it. Now this example on the left-hand side contains a lot of the HDL, the high density lipoprotein, the good cholesterol, the blue dots, and of course a few LDL. The right-hand side, however, the roles are reversed. Very little good cholesterol and a lot of the bad stuff. Now what happens with the LDL, the bad cholesterol, it begins to stick to the artery walls. And as you can see, the artery becomes narrow over time. And that's how blood pressure often rises. It's because the heart is having to force the blood through these very narrow passageways. And sometimes it can potentially lead to a blockage, which can lead to a heart attack or a stroke. A blockage to the heart is a heart attack. A blockage to the brain is a stroke. Now the question is, why do we need HDL? Well, the role of the HDL, the good cholesterol, is to remove the bad stuff from the artery walls. Its nickname is the scavenger. So it's almost like a pipe cleaner, if you like, to clean out the arteries, to keep them clean and clear so the blood can flow easily around the body. I also wanted to quickly show you this on the screen here at the bottom, the desirable range for our cholesterol levels. We also have the raised in the amber and then the high in the red. So let's just focus on the desirable for a second. Total cholesterol, the number should be 5 or less. The HDL, which is the good stuff, should be above 1.11. And there's no top end to that. There's no high, because the higher the better for HDL. The LDL, we want to keep that to a minimum between 2.6 and 3.3. Now, as you notice, the LDL is often higher than the HDL, and that's perfectly normal. The triglycerides, as I said, are important, but again, we want to keep them low, less than 1.7. And you can find all these numbers out from a blood test. As I mentioned in the outline, I want to talk quickly about cardiovascular disease, which is the umbrella term that describes all diseases of the heart and the circulatory system. Cardiovascular disease is sometimes called heart disease, but in medical terms, they're not exactly the same thing. Heart disease is a general term for conditions affecting the structure of the heart or the way it functions, if you like. All heart disease are cardiovascular disease. However, not all cardiovascular disease is heart disease. I hope that makes sense. So an example is a stroke. A stroke which affects blood vessels to the brain, but it doesn't really affect the heart itself. But here on the screen are specifically associated to the heart. And there are a number of types of heart disease with multiple causes. Many times a process called atherosclerosis is a part of the problem. Atherosclerosis is that fatty substance, that fatty material which builds up on the inside of the artery walls that we just took a look at, and it can make it hard for the blood to flow through those. But here on the screen we've got coronary artery disease, which you may be familiar with. Again, that's caused by that build-up on the artery walls. Heart valve disease, as we know, the heart has 4 chambers, 4 valves then, that keeps the blood moving in the right direction. As the heart muscle beats, the valve open and close. Now, heart valve disease happens when one or more of the valves in a person's heart do not work how they should. We've got aneurysm. Aortic aneurysm is a bulge that occurs in the wall of the major blood vessel. We've also got heart arrhythmia or cardiac arrhythmia at the bottom there. It's when the heart doesn't beat as it should, either beating too fast or too slow, as we mentioned earlier. Cardiomyopathy at the bottom. It's a type of heart disease that can cause the muscle tissue to become weak, making it harder for the heart to pump the blood in the right way. We've got pericarditis. A thin layer of tissue called the pericardium surrounds your heart. Its job is to hold your heart in place and help it work properly. And this pericarditis is when it becomes inflamed or swollen. And then we've got congestive heart failure. And this is a serious and a long-term condition that gets worse over time. Heart failure doesn't mean that the heart stops working completely. It just means the heart no longer works as well as it should. So risk factors for cardiovascular health, particular behaviors, habits, circumstances, our environment, even conditions that increase a person's risk of developing cardiovascular or heart disease in particular. But it can be split into 2 categories, modifiable and non-modifiable. Now, the non-modifiable are those that cannot be meaningfully changed in any way. As you can see there, things like age, ethnicity, family history, genetics, among other factors. However, it's the modifiable cardiovascular risk factors that I want to pay particular attention to here. Things like high blood pressure, high cholesterol levels, diabetes, physical inactivity, smoking, obesity, can all be meaningfully changed through our lifestyle behaviors. Possessing one or more risk factor increases a person's risk of developing cardiovascular disease. In fact, physical inactivity is a major health risk and is one of the main causes of death and disability in the developed countries of the world. Over 1 in every 5 cases of coronary heart disease is due to physical inactivity. So what is health screening and why is it important? Well, a health screening assessment is known as a preventative health check, and it uses medical and non-invasive tests to give an overview of your current health and well-being. So we'll assess things like your blood pressure, your cholesterol levels, potentially your blood sugar, your glucose. It's performed by a trained health clinician who will carry out the assessment, feedback any immediate results, and discuss any specific concerns you may have, whilst offering advice and guidance in ways to improve your general health. So why is it important? Screening can detect a problem early, potentially before you have any symptoms at all. Finding out about a problem early can mean treatment can be much more effective. Discovering you may have a health problem, such as high cholesterol or high blood pressure, or an increased chance of a health problem can help you make a better informed decision about your overall health. If, for example, you came back with a high score, high cholesterol, then the guidance would often be to speak to your GP as soon as possible, so that then they could offer the best course of action, whether that be changes to your lifestyle, whether it be any sort of treatment or medication. So here on the screen actually is what the ToHealth health assessment matrix looks like. We offer a number of different packages, ranging from the sort of MOTs, the basic, through to the more in-depth executive assessments. I just want to pull out a few things here. The heart health, for example, as we're talking about heart health today, we'll do things like blood pressure. We'll do that with all the different assessments. The cardiac assessment is like a 10-year cardiovascular risk score. It's also known as the Q-risk, and it's an algorithm that calculates a person's risk of developing a heart attack or stroke over the next 10 years. We input the data into the software and it helps predict this risk over 10 years. If it comes back low, you often have less than 10% chance of any sort of CVD. If it's moderate, that's between 10 and 20%, and if it's high, it's 20% chance or higher of heart or circulation problems in the next 10 years. Heart rhythm screening too. ECG, electrocardiogram, is a test that records the electrical activity of the heart. So the ECG reflects, what happens in different areas of the heart and helps identify any problems with the rhythm of the heart. When we talked about arrhythmia earlier, it could be a fast heartbeat or a slow or even a regular wave. ECG is painless, takes about 5 to 10 minutes to perform, sometimes less. We also do blood tests, blood analysis, so things like the cholesterol reading, as well as glucose and HbA1c. So I want to finish up today's session, the last few minutes, talking about epigenetics. It is the study of how our behavior and our environment and our habits can cause changes that affect the way our genes work. Epigenetics changes the activity of our DNA, so it doesn't alter our genes, but rather offers an additional layer of information, so letting individuals play the cards that they've been dealt to their advantage, if that makes sense. So it identifies how behaviors and the environment around us impact the way our genes work, how they're switched on and switched off. So epigenetics does not tell you if you'll get cancer or Parkinson's or what your family history is, but it tells you about the genes that we can influence in a positive way. I'll give you a great example. Identical twins are a great example of how epigenetic works, because identical twins have identical genes, identical genomes, DNA, and it's been said that identical twins are ideal subjects for studying the effects of epigenetics. Because sadly, as we know, there'll be cases whereby one twin may develop cancer at some stage in their life, whilst the other twin doesn't, and this could potentially be due to lifestyle, behaviors, and the environment that we find ourselves in. But your genes play an important role, don't they? But as we have identified, so do your behaviors and your environment. Now we actually have 2 ages. Okay, we have the chronological age, which is the exact number of years you've been alive. We also have our biological age. Biological age is a true reflection of how your cells are aging. Your biological age and internal health can be affected by things like your diet, your exercise, your lifestyle, your environment. We often focus on our chronological age too much, when it's this biological age that we should really be honing in on. And I suppose a tailored and hyper-personal journey to epigenetics, it starts with a simple saliva test. That's all it is. And we can really take a close look at how your DNA is responding to your lifestyle. Because as you can see on the image on the screen, epigenetics is closely related to cardiovascular disease, heart disease. And it's actually a promising field in the diagnosis and intervention of CVD. Things like smoking, obesity, diabetes, dyslipidemia at the bottom there, which is it's that irregularity of our cholesterol, can all impact our epigenetics and can have a profound impact on our conditions, such as cardiomyopathy and that furring of the arteries that I mentioned earlier, the atherosclerosis, as well as vascular dysfunction and heart failure. But it's not all bad news. One simple non-intrusive test that we can all take to find out this information is the DNA epigenetics test. So you download the app, the ToHealth app, from the Apple or Android store and register for a kit. It'll arrive in the post, whereby you'll be asked to provide that saliva sample. Simple as that. The saliva will mix with the solution, the scap, but just make sure the cap is screwed on tightly. Send the sample back, and they have a prepaid envelope, and it'll be analysed back at the lab straight away. But sit tight. The results can sometimes take between 4 to 8 weeks, but we'll keep you informed. So we'll send you messages to let you know that the lab has received it and processing it, and when you should look to expect it in return. And with your results, your kit, you'll receive some really in-depth reports to better equip you for whatever life lies ahead. So your DNA profile looks at many different areas of your relation of your health, if you like. Your diet, from how your body responds to carbohydrates to your risk of being lactose intolerant, with much more in between. Even things like your genetic obesity risk. Also, understanding how your body performs to its best can make the difference in your exercise or training plan. Discovering your muscle power, your stamina, your anaerobic threshold, your recovery rate too. Vitamins too. I'll talk about vitamins, critically important to your health and well-being. You'll receive up to 13 reports detailing your specific health risks to being deficient to vital micronutrients, including iron and magnesium and vitamins, vitamin B12. Also, get to know the important areas of your health that's affected by your genetic makeup, such as your, as I said, the genetic obesity risk, type 2 diabetes risk, even your genetic risk of infection, so colds and flus and viruses. So really in-depth report. And I'm conscious the time is 10 o'clock, so I'm going to leave you there. So thank you so much for joining me today, for listening, for taking part. If you do have any queries, any questions, in the Q&A, there's a little sort of address you can follow. There's also the inquiries number on the screen there. All that's left to say is thank you for listening. Enjoy the rest of your day. Enjoy the rest of your week. Take care and goodbye.